How do I interpret DaTscan results? Interpreting DaTscan results can be quite important for understanding Parkinson's disease and similar conditions. DaTscan, which is also known as Ioflupane I-123, is a type of imaging test that uses a radiotracer. This test is performed using a method called brain single-photon emission computed tomography, or SPECT. The radiotracer binds to dopamine active transporters in the brain. These transporters are crucial for the neurons that help control movement, particularly in an area called the striatum. In Parkinson's disease, there is a loss of these neurons, which leads to a decrease in dopamine levels. This reduction is reflected in the DaTscan results. When you look at a DaTscan, the interpretation is primarily visual. A normal scan will show a distinct, comma-shaped pattern of radiotracer uptake in the striatum. This indicates that the dopamine-secreting cells are functioning well. On the other hand, if the scan shows a loss of this pattern, it suggests reduced binding of the dopamine active transporter. This is a sign of a dopaminergic deficit, which is common in Parkinson's disease and other neurodegenerative conditions. DaTscan can also help distinguish Parkinson's disease from other movement disorders, such as essential tremor or drug-induced Parkinsonism. However, it is important to note that DaTscan cannot differentiate Parkinson's disease from atypical Parkinsonian syndromes like multiple system atrophy, progressive supranuclear palsy, or corticobasal degeneration. In terms of accuracy, DaTscan has a high specificity, which means it is very reliable in confirming the presence of a dopaminergic deficit. However, its sensitivity can vary depending on the stage of the disease and how certain the clinical diagnosis is. A negative result on a DaTscan does not completely rule out Parkinson's disease, especially in its early stages or in atypical cases. The best use of DaTscan is when there is uncertainty in the clinical diagnosis. It can confirm the presence of a dopaminergic deficit, which aligns with Parkinson's disease or other similar conditions. This imaging technique supports the diagnosis and can guide treatment decisions by helping to differentiate Parkinson's disease from other disorders. While DaTscan is not primarily used for monitoring disease progression, it can provide insights into how much dopaminergic neuron loss has occurred over time. Understanding the results of a DaTscan requires both knowledge of the visual patterns and the clinical context in which the test was performed. It is a valuable tool in diagnosing Parkinson's disease, but it should be used alongside other clinical evaluations and diagnostic methods for the most accurate diagnosis and treatment planning. For personalized advice regarding DaTscan results, it is always best to consult a healthcare professional.